Hi, this is Jessica DeMassa, and I'm here with Matt Hawkins. He's the CEO of Waystar. So tell me about Waystar.
Good morning. Waystar is the recently combined merger of Navicure and Zirmed, and we're new to market. We're really excited. Two great companies in Navicure and Zirmed that have come together to form Waystar.
And I understand you're in the extra sexy business of revenue cycle management, which seems to be having a moment actually right now at HIMSS.
It is.
So tell me a little bit about what's happening in rev cycle management. Why is it so sexy right now?
It's really sexy to collect money, especially for the services that you've performed. I think what's becoming really important and well recognized is that transparency in knowing what you're actually entitled to collect from a patient when you've offered great health services is something that's important. There are a lot of resources devoted to getting reimbursed for the services that a provider, a health system, a doctor's office performs, and so we help do that. And the thing that stands out to me, what's I think in vogue right now, is that revenue cycle reaches all the way forward to the patient access, patient registration process. And when a patient registers, for the patient to have clarity around what their financial responsibility is very important. We know that like 75% of patients go to a doctor's office and don't even know what they're obligated to pay until after the service is performed.
Right.
And only 10% of patients ever price shop. And so what's sexy is now there are technologies that can help a patient register for an appointment, and then there are technologies that can quickly validate that a patient has insurance, that can authorize that indeed the patient is entitled to receive insurance, and the provider can go in knowing in advance what the situation is with the patient. And then that drives everything downstream.
I think it's interesting that, it seems like the conversation about rev cycle management has now started to pull the patient in. So it's like this kind of goes with that larger macro trend in healthcare of consumerism, right? So talk to me a little bit more about that. How else do you see like this growing, rise of focus on the consumer, the healthcare consumer, impact what you guys are doing from the rev cycle management side?
Sure. So, in other industries, we're accustomed as consumers to buying things online. We shop for cars, we do our banking, we shop for clothes online, and then we go to healthcare. And up until now, there haven't been a lot of options to indeed consume healthcare services from an online perspective. We don't price shop, we don't compare, we don't do quality checks. And so now I think going back to this, what's sexy about revenue cycle technology and consumerism is that truly there are technologies out there that are capturing consumer interest and enabling the consumer as a patient to get access to understand price, to get access and understand transparency around quality of service, and lots of other things that are very exciting.
So we're seeing this march into healthcare from some of these big consumer companies. So Google's got Verily, and they're launching an insurance product now, and then we've got, the greatest consumer engagement company of them all, Amazon, in this space. So how do you think that's going to disrupt rev cycle management?
Well, so Amazon and Google are both very good at understanding the consumer experience. And indeed, with recent announcements in the industry, there's a lot of interest in what will follow for the consumer, what will follow for the patient. I'm excited to see what will happen there. I believe that the consumer should be empowered to understand right from the outset price, quality, just like they would in any other consumer-oriented sense.
How do you think that's going to change the way, though, that rev cycle management is done? Or do you think it's not going to? Because they start bringing in blockchain, they start bringing in deep machine learning, AI, all that stuff. Is that going to change what we're currently doing?
Absolutely. What will change will be the way technology is used to capture an experience from end to end. So right now there's lots of point solutions out there that maybe captures the patient registration or insurance eligibility experience, or the downstream claims processing or denials management experience. What's happening now, and what Waystar's focused on, quite frankly, is the ability to unify that entire experience into one technology platform. And I think that's what's most exciting. If we can understand right from the outset what the patient obligation is, then we can dramatically shorten the revenue cycle length of time. And we can demonstrate, we can bring clarity and better experience to the patient. We can actually bring better experience to the provider. the providers don't know what they're obligated to even get for the services that they're offering. Tell me another industry that does that.
No.
It's like going to a sandwich shop as a consumer, walking in and saying, I want the turkey sandwich, without seeing a price menu, saying my Aunt Sally's going to come in and pay for it at some point in time. On the other side, the sandwich shop owner and maker of the sandwiches is committed to, making a good sandwich, but they don't know what they're even going to get for making the sandwich. So that's a really obfuscated experience. What's exciting now is bringing clarity to that whole process from end to end.
Is it going to make healthcare cheaper?
Yes, it has to. Look at the billions of dollars being spent on healthcare services today, and so much of that is tied up in the revenue collection process. At the long tail of managing claims and managing denials, spending thousands and millions of dollars on trying to do that in health systems today.
All right, so last question for you. We're asking everybody, Matt, for your WTF health moment here, and that means what's the future health? So things are broken now, right? And we need a better future. So what's the future for rev cycle management?
So it's the unification of all of the data from end to end. So from the moment that a patient engages to that long tail of managing the denial, and unifying that data enables all sorts of AI and algorithms, predictive algorithms to be applied to it. And I think the future of revenue cycle management is getting smarter, better, and faster at understanding what a patient is responsible to pay, what a provider is responsible to receive, and it will drive all sorts of waste out of the healthcare system today.
Hope so.
Yes.
All right, thanks so much, Matt. It's great talking to you. Thank you.
Thank you.